Hi everyone, my name is Peter. Welcome to this section. Today we're going to look at the pharmacology of how to manage Parkinson's disease. And today's objective is we are going to look at the levodopa therapy used in management of this disease. So therefore, in my previous YouTube tutorial, I talked about more of Parkinsonism and how it's what causes Parkinsonism. Just a recap. Parkinsonism is a neuro disease that originates from the nigrostriatal pathway. This pathway contains dopamine neurons, and these neurons are depleted with absence of dopa. So therefore, this absence of dopa leads to all these effects, posture movements seen in Parkinsonism. So now today we are going to see how the levodopa therapy plays a role in management of Parkinsonism. So therefore, we know that dopa is the neurotransmitter in the nigrostriatal neurons. So therefore, depression of dopa leads to all these side effects, so all these symptoms we see in Parkinsonism. So one of the major goals was using levodopa or using dopamine to help in the management. So therefore, to begin with the levodopa, so levodopa is a precursor, is an intermediate in the catecholamine synthesis. Catecholamines. So catecholamines have a structure that looks like this. So this is catechol. So catecholamines have for a compound to be called a catecholamine, it must have this benzene ring and an amine. And levodopa is a catecholamine, because it possesses both of these. So therefore, levodopa is used in the management of Parkinsonism, reason being that it is converted to dopamine when it is taken into the body. So this levodopa is metabolized by an enzyme called dopa decarboxylase. So this enzyme dopa decarboxylase takes off this carboxylic acid off on this levodopa, and then we get the neurotransmitter dopamine. Now this is the neurotransmitter dopamine used in the central nervous system within the nigrostriatal pathway. So this dopamine is going to be used by the body so that it replenishes the lost dopamine in the nigrostriatal pathway, so that it helps the patient who has Parkinsonism, so that the movements are more smoother and also the posture movement and all other symptoms seen in Parkinsonism. So therefore, this drug levodopa is given together with some other drug that we are going to see. Reason being that this enzyme dopamine decarboxylase is found in the cytoplasm of most of the cells. So therefore, when you take this drug levodopa as it is, it's going to be broken down before it reaches the central nervous system. So it will be broken down to form dopamine. And further, this dopamine can be broken down further to form norepinephrine and epinephrine, as we shall see later. So now, as for now, we cannot give levodopa alone because of this enzyme, dopa decarboxylase. So therefore, we introduce in another drug called carbidopa. Carbidopa is structurally similar to levodopa. If I may draw the structure here for compound, so that you can compare and see how these two structures look alike. So this is the structure of carbidopa. So when we give these two drugs together, what is going to happen is that this enzyme, dopamine, dopa decarboxylase, is going to be inhibited or is by this carbidopa. So therefore, our levodopa will be converted to dopamine in the central nervous system, but not in the peripheral nervous system. So therefore, this drug carbidopa plays a very important role in the levodopa therapy, as we've seen that for now. So now, let us see what other important factors that we have to know as far as levodopa therapy is concerned. So to go back to this enzyme, dopa decarboxylase. So this enzyme has a coenzyme, which is an amino and a vitamin, which is vitamin B6 or pyridoxine. So pyridoxine is a coenzyme of dopa decarboxylase. So when you give pyridoxine together with levodopa, you're going to increase the metabolism of the levodopa, because this coenzyme or this vitamin B6 or pyridoxine is going to help, is a coenzyme, is going to facilitate more of the breaking down of levodopa into dopamine in the periphery. So therefore, it's cautious when you're giving a patient levodopa with any supplement that contains pyridoxine. But this is a bit minimal, because since we have carbidopa, as we've seen, carbidopa inhibits this enzyme, so therefore it's very we do not have to worry more the effect of this coenzyme on breaking down of levodopa, since carbidopa will fill up that gap. So therefore, we've seen how levodopa and carbidopa together play a role in management of Parkinsonism. So therefore, let us go straight to the side effects. What are some of the side effects of levodopa therapy? So levodopa stroke carbidopa. So some of the side effects: one, we have gastro upset or irritation. So gastric upset or irritation is first of all caused by the local presence of dopamine in the intestines, and also when levodopa crosses and goes to the brain, it triggers the emetic system. In the brainstem, we have an area called the postrema in the brainstem. So this area postrema in brainstem contains what we call the emetic center. So this emetic center can easily be accessed by many emetic substances, since in this area there is what we call poor blood-brain barrier. So if there is poor blood-brain barrier, so very many substances can reach this area and trigger the emetic center. So therefore, levodopa therapy or levodopa has that ability of causing this center, of stimulating this center, causing gastric upset, irritation, nausea, and vomiting. So this is the major side effect seen in treatment with levodopa. And another side effect, another common side effect is that sometimes this levodopa can be broken down in the periphery. So if it's broken down in the periphery, it's going to be metabolized into adrenaline or epinephrine or norepinephrine. So you know that, let me draw back the structure of dopamine. So this dopamine, when it undergoes beta hydroxylase to form norepinephrine. So now this is norepinephrine. So this norepinephrine can further be broken down, can further be metabolized by some enzyme by adding a methyl group on this area. So one of the hydrogens is taken off and it becomes epinephrine. So now you know the effects of epinephrine is going to cause vasoconstriction. It's going to increase the blood pressure when it activates the beta-1 receptors and also the beta-2 receptors in the lungs. So therefore we are going to have breathing, fast breathing, high blood pressure, vasoconstriction. So therefore the patient is going to be in the fight and flight mode. So therefore those are the two major side effects seen in the treatment of levodopa under Parkinsonism. So thank you very much for watching. See you next time as we discuss more drugs in the management of Parkinsonism. Bye for now.